President Trump is trying to end division in this country, not sow division.
Not eviction.
During the last 4 years, that's what DEI did. It divided people. It polarized people.
No. We're not talking about eviction. We're talking about healthcare.
I'm calling about DEI.
We're talking about healthcare.
Yeah,
disparities. So what we're asking is if you attack DE&I and then we have a crisis that impacts one.
Welcome back to Freedom Forge. If you believe in truth, accountability, and cutting through the noise, go ahead and hit that like button and subscribe right now. Because what we're about to break down today is another Senate hearing that perfectly captures where this country is headed. Today's hearing centers around a top government official being questioned by lawmakers on healthcare policy, specifically maternal health in the United States, and more broadly, the role of government programs tied to diversity, equity, and inclusion. What starts as a discussion about maternal mortality quickly turns into a heated clash over race-focused policies, government spending, and whether targeting specific groups is the right approach to solving national health problems.
I recognize the gentlelady from Pennsylvania, Ms. Lee.
Thank you, Mr. Chairman. So this is Black Maternal Health Week, so I'll just start there. Secretary Kennedy, I'm sure you're aware that Black women are at least 3 times more likely to die from pregnancy-related causes than white women. The vast majority of those deaths are preventable. Black women in my district are more likely to die during pregnancy than their peers in 97% of U.S. cities. Your written testimony mentions maternal and child health 4 times, but from what I've seen, the NIH canceled grants researching Black maternal health. Your administration's fiscal year 27 budget proposes eliminating Healthy Start, which is one of the federal government's primary community-based maternal health programs. And you've made it a priority of HHS to end diversity, equity, and inclusion. So yes or no, my question for you is, if a medical school or a public health school educates students about addressing the Black maternal mortality crisis, would you consider that an illegal DEI?
No.
No, you would not?
No.
Great. I do hope for the medical schools, the universities, and the accreditors, your administration has been threatening that they're watching this and take this directive to continue teaching about and addressing the Black maternal mortality crisis. And I expect your agency to restore and expand funding and support for that work. Also, yes or no, do you think consuming more protein and avoiding Tylenol will prevent Black women from dying 3 times more likely during a pregnancy?
I doubt it. Tylenol doesn't kill you.
So then why aren't you putting forth serious policies that actually address the health crises in this country instead of just these unserious conspiracy theories and this wellness influencer mess that we
You want me to answer that question, or are you just talking?
No, it's a question.
We are doing more on maternal health than any other administration.
No, I said Black maternal health.
On maternal health.
Black maternal health.
That includes Blacks and whites.
But the thing is that they're actually not the same outcomes, which means that we need specific and intentional interventions for Black maternal health and Black infant.
Can I finish? I'm saying.
Are you going to answer that?
Yeah, we have right now, we've implemented a perinatal pilot project that we're in 220 hospitals around the country. And we have reduced maternal health mortalities by 42% at those hospitals by providing them protocols.
Can you please share what the reduction has been for Black maternal health?
Across the board, it's 42%.
But Black maternal health still has worse outcomes than other people.
I wouldn't know. It helps everybody.
But it isn't.
You object to that?
Okay, thank you. It is not. I do want to just, for the record, state that. It does not help everyone. Your agency told programs to remove a list of nearly 200 words and phrases from their funding applications, including the word Black. Do you have an idea of how we could solve the Black maternal mortality crisis if we can't say Black?
President Trump is trying to end division in this country, not sow division.
Not eviction.
During the last 4 years. That's what DEI did. It divided people. It polarized people.
No. We're not talking about eviction. We're talking about healthcare.
I'm calling about DEI.
We're talking about healthcare.
Yeah.
Disparities. So what we're asking is if you attack DE&I and then we have a crisis that impacts one population over another, but you cannot direct specific spending or research or interventions to that population, how do you solve the problem?
Do you think the federal government should be paying for DEI?
I think the federal government has a vested interest in ensuring that its citizens survive childbirth.
Well, we are meeting that obligation.
We are not.
Oh, that I can explain to you how we are. If you
You have not done so far. But also, I would say that we can improve healthcare for everybody at the same time as helping the people who are most likely to die. That's what DE&I. Well, first of all, DE&I makes sure that we have Black doctors or women doctors, or that we're talking about the fact that we have a mortality rate that is not matched by any other country as what we would call developed as ours. Really quickly, in yesterday's Ways and Means Committee hearing, you denied saying that every Black kid is now just a standard put on Adderall, SSRIs, benzos, which are known to induce violence, and those kids are going to have a chance to go somewhere else and get reparented. Why did you deny saying this?
Why did I deny payment?
No, why did you deny that you said that every Black kid is now just standard put on Adderall, SSRIs, benzos, which are known as to induce violence, and that you would rehome them?
Well, it's largely true that Black kids, because it's easier to handle people, and a lot of the public
And you're going to
schools-
rehome them?
No, I never said that we should rehome them for illegal drugs. Psychiatric.
Gentlelady's
which
time
every
has
Black kid
expired.
is now just-
Okay, I just wanted to know if that was him for the record. Thank you.
Thank the
I yield
gentlelady.
back.
Now, as we get into this, you can immediately see the tone of the questioning. A lawmaker opens by highlighting disparities in maternal health outcomes, particularly among Black women, and pushes the official on whether current policies are doing enough to address that gap. And look, this is a serious issue. No one is denying that maternal health in America needs improvement. But what follows is where the debate really shifts. The questioning quickly turns into a broader argument about DEI, diversity, equity, and inclusion, and whether the government should be funding or prioritizing programs specifically targeted at certain racial groups. The official makes it clear that the administration's position is to move away from DEI-based frameworks and instead focus on improving healthcare outcomes across the board for everyone. And this is where, from a conservative standpoint, the argument becomes very clear. The idea is simple. You fix the system for everyone, you raise standard across the board, and you don't divide people into categories where some groups are treated differently under government policy. The belief here is that equality under the law means exactly that: equal treatment, not selective prioritization. But the lawmaker pushes back hard, arguing that if one group is statistically more affected, then targeted intervention is necessary. And this is the fundamental ideological clash we're seeing play out in real time. One side believes in universal solutions. The other believes in targeted, identity-based policy. Now, here's something important that came out during this exchange. The official points to a pilot program that reportedly reduced maternal mortality by 42% across participating hospitals. That's not a small number. That's significant. That's real-world impact. But instead of focusing on how that success can be expanded, the conversation keeps circling back to whether the results specifically closed racial gaps. And this is where I think a lot of Americans watching this are going to ask a simple question. If a policy is saving lives across the board, shouldn't that be the priority? Shouldn't we be scaling what works instead of arguing over how to label it? Then things escalate even further when the discussion moves into language restrictions and the removal of certain terms from funding applications, including references to race. The lawmaker argues that without explicitly naming the problem, you can't solve it. The official counters by saying that the goal is to reduce division and avoid policies that categorize Americans by race. And again, this is a deeper philosophical divide. Is the solution to focus on differences or to focus on shared outcomes? Is unity achieved by emphasizing identity or by emphasizing common ground? From a right-wing perspective, the concern is that once you start building policy around identity categories, you open the door to endless division, political favoritism, and bureaucratic overreach. Instead of solving problems, you risk creating new ones, where groups compete for attention, funding, and influence. Now, toward the end of the exchange, things take an even sharper turn. The lawmaker brings up past controversial statements allegedly made by the official regarding medication and treatment of certain populations. The questioning becomes more aggressive, more confrontational, And you can clearly see the hearing shift from policy discussion into political point scoring. And this is something we've been seeing more and more in these hearings. Instead of calm, fact-based discussions about how to improve the country, they turn into moments designed for headlines, clips, and viral reactions. But here's the takeaway. Beneath all the noise, there are real issues being discussed: maternal health, healthcare access, and how government policy should address disparities. The disagreement isn't about whether these problems exist. It's about how to solve them. Do you fix the system as a whole and trust that improvements will lift everyone? Or do you create targeted policies aimed at specific groups based on data and outcomes? That's the question at the heart of this hearing. And as always, the answer depends on what you believe the role of government should be. If you want more breakdowns like this, real analysis, real context, no fluff, make sure you like this video, subscribe to Freedom Forge, and stay tuned.